Sometimes, even with proper brushing and flossing, you may need to have a tooth removed. A tooth may need to be removed because of crowding, decay, accidental damage, or in preparation for full mouth dentures. Since tooth extraction is a surgical procedure, it's natural that you'll notice changes in your mouth after the procedure. After an extraction, you may receive special instructions that explain how to best care for your mouth. It's important to speak with your dentist if you have any questions or problems. There are some general guidelines that will help to promote healing, prevent complications, and make you more comfortable post-operation. Typically, when you have a tooth extracted, you will receive an anesthetic. The amount of time you experience numbness post-operation will vary depending on the type of anesthetic used, the amount used, and the area that was anesthetized. During the time that your mouth is numb, be sure to take some extra precautions. You want to be careful that you do not bite the inside of your cheek, your lip, or tongue. It's important that you avoid any foods that require chewing while your mouth is numb. If you have liquid foods or beverages, do not drink through a straw. The sucking action from using a straw could loosen the blood clot and prevent or delay proper healing. The numbness should subside after a few hours. If the numbness doesn't go away, contact your dentist. After your tooth has been pulled, your dentist may place a gauze pack in the area where the tooth was pulled. This will help limit the bleeding while clotting takes place. You should leave the gauze pack in your mouth for 30 to 45 minutes after you leave the dentist's office. Be careful not to chew on the gauze. Once you remove the gauze pack, there may be some bleeding or oozing. If you experience this, fold a clean piece of gauze into a pad just thick enough to bite on. Then dampen the pad with clean, warm water and place it directly on the extraction site. Bite down firmly on the pad and try to maintain moderate pressure for about 30 minutes. If the pad becomes soaked with blood, replace the pad with clean gauze as needed. Be sure you don't suck on the extraction or bother it with your tongue. This could slow down the healing process. It's normal for a small amount of blood to leak from the extraction site until a blood clot forms. If you experience heavy bleeding, contact your dentist. Keep in mind that a small amount of blood mixed with a lot of saliva can look like a lot of blood. After a tooth extraction, a blood clot forms in the empty tooth socket. A blood clot is an important part of the normal healing process. For the first 24 hours of the healing phase, you should take special care to avoid activities that might disturb the clot. Avoid smoking, rinsing your mouth vigorously, or drinking through a straw, since these activities create suction in the mouth. Also, avoid alcoholic beverages or mouthwash containing alcohol, and limit strenuous activity. Occasionally, a blood clot doesn't form after an extraction, or it forms but breaks down. The result is called dry socket. Dry socket can be very painful. If you experience it, call your dentist. To help alleviate the pain, a dressing may be placed in the socket to protect it until the socket heals. Depending on your health history, your dentist may prescribe medication to control pain and prevent infection. If the prescribed pain medication doesn't work for you, do not increase your dosage or take the medication more often than directed. If you have any difficulties or side effects from the medication, contact your dentist. After a tooth extraction, it's normal to experience minor pain and swelling. To help reduce any pain or swelling, try applying a cold compress to your face, as directed by your dentist. You can also try an ice bag or a cold, moist cloth. Your dentist may give you specific directions on how long and how often you should use a cold compress. Your dentist may also give you a cold pack to use on your way home from the office. Severe or prolonged pain, swelling, bleeding, fever, nausea, or vomiting is not normal. If you experience those symptoms, call your dentist immediately. If you can't reach your dentist, go to the nearest hospital emergency room. For the rest of the day that your tooth is extracted, Brush and floss as normal, but avoid cleaning the teeth directly next to the healing socket. The next day, you can begin cleaning the teeth next to the socket. Be sure to brush your tongue. This will help eliminate the bad breath and the unpleasant taste that are common after an extraction. Gently rinse your mouth afterward with a warm saltwater solution of a half teaspoon salt and 8 ounces of warm water. Remember, do not rinse your mouth too vigorously. After the extraction, drink lots of liquids and eat soft, nutritious foods. Begin eating solid foods the next day, or as soon as you can chew comfortably. For the first few days, try to chew food on the other side of your mouth. By taking extra care of your mouth after a tooth extraction, you can help avoid complications and promote healing.